We're now live.
Good evening, everybody. Welcome to this meeting of the Health and Adult Social Care Overview and Scrutiny. My name is Councillor Patrick Canavan. Welcome to everybody in the room and those who have colleagues who have joined us online. Welcome to Councillor Armstrong. I think this is Councillor Armstrong's first meeting of this committee, so warm welcome to you. I'm going to hand over to the Democratic Services Officer to read the housekeeping notice, please.
Thank you, Chair. Please note that this meeting is being recorded by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. The meeting may also be recorded or streamed for live or subsequent broadcast by members of the public, although ultimate discretion in this matter lies with the Chair. For those in the room, please note that if the fire alarm sounds, please exit the building by way of the nearest available signed fire exit route and make your way to the assembly point in the front car park of this building. Finally, please ensure background noise is kept to a minimum and mobile phones and other devices are turned off or switched to silent for the duration of the meeting. For those in the room, this includes turning off microphones when not in use and turning the volume down completely on your laptops. Thank you.
Thank you very much indeed. Do we have any apologies, please?
Yes, Chair. We've received apologies today from Louise Bates and councillors Michelle Dower and Hazel Allen.
Thank you. I think Councillor Allen, I can see Councillor Allen is online, so welcome, Hazel. I can see you there. Thank you very much. Any substitute members?
No, Chair.
So thank you very much. I'm going to move on to item 3 on the agenda, and at this point I need to hand over to Councillor Dedman in her role as Chair of the Council in order to oversee this bit of the agenda, please.
Yes, thank you very much, Councillor. This is the election of the Chair and of the Health and Adult Social Care Overview and Scrutiny Committee. So I'm asking for nominations from the floor for election of Chair. This is for 26 to 27. Do I have any nominations, please? Councillor Northover.
Could I nominate Councillor Canavan, please?
Do you have a seconder? Councillor Matthews, thank you. Any more nominations? Right, can we all vote on that then? In favour? Right, I think I can hand back to you, Councillor Canavan. Congratulations.
Thank you very much, and thank you, everybody. It's a real privilege to do this, so I'm most grateful. So item 4 on the agenda is the election of Vice Chair. And if I may use Chair's privilege for a second, I would like to nominate Councillor Northover. Do I have a seconder, please? Thank you very much, Councillor Armstrong. Any other nominations? If not, I can declare Councillor Northover elected. Thank you very much and congratulations. Are there any declarations of interest, please? Anybody got any declarations of interest? I know Councillor Allen's online. We will take hers as read because she tells us every time. But thank you. Any others? Thank you very much indeed. If anything occurs during the course of the meeting, then please just let me know. Okay, so we've got confirmation of the minutes to agree. These are the minutes of the meeting held on the 2nd of March 2026, which feels like quite a long time ago. Is there any points or comments on those minutes, or can I take consensus that we agree them? Everybody content with them? Okay, thank you very much indeed. Also need just to note the recommendation tracker. Obviously this is just an ongoing update that we keep. So unless there are any particular points anybody wants to raise on that, it's quite a long document because it covers all of the committees, but if there are no particular issues, then I will just take it as read if that's acceptable to everybody. Okay, thank you very much. So moving on, Are there any public issues?
There are no public issues, Chair.
Thank you very much. So at this point in the agenda, I am going to make something up because I need to just let the committee know that this is Betty Botlin's last meeting of the Health and Adult Social Care Overview and Scrutiny Committee. And I just want to say a big thank you for all of your input and help during this period. And I'm going to make a little presentation. So I'm doing that now because I would forget otherwise. But you're free to say anything you want, even insults to me is good.
Yeah, I just wanted to say thank you ever so much. And I've really thoroughly enjoyed working with the committee and the chairs. And yeah, have absolutely loved it. And I know that it will carry on doing the amazing work that it's doing. And thank you ever so much again. I really, really appreciate it. Thank you.
Thank you. Moving swiftly on then to item 9, which is the corporate performance report for Q3. This is just something which is has been circulated for information, really. It dates back to the beginning of March, something which has been looked at elsewhere, but it is there for your information. And if there are any questions on it, please do not hesitate but to shout and let me know. Otherwise, I'm just going to ask you to accept it as an information item. Everybody okay with that? Thank you very much indeed. Okay, item 10 is the work plan, and I'm pleased to say I've got Lindsay online because she'll no doubt correct me when I do this wrong. So I just wanted to run through where we kind of are with the work plan. So you recall that there was a questionnaire circulated and we've had some responses to that. And the Democratic Services team have kind of plotted out the topics in the most appropriate timescales to enable us to do that scrutiny on those particular issues. So the Overview and Scrutiny Chairs and Vice Chairs group has considered all of the proposals that have come forward and tried to put those in a particular order, which I'm going to just outline. So in terms of the overview and scrutiny items, the first of those is the van life, which you may be aware was already an issue that is being looked at in the Environment and Place Committee following a motion that was carried at council. That's in progress. The other thing, or another thing, is the children's well-being. So this was a piece of work that is going to be jointly run by this committee and the Children's Overview and Scrutiny Committee. And the proposal is that this will be a working group between the two committees, which will need to work out the membership of in due course. But there is a, a draft key line of inquiry document which is being worked on. So that's the next thing that is going to be looked at. One of the other things that we talked about with the overview and scrutiny chairs and vice chairs is how we might approach budget scrutiny this year, and that's going to depend a bit on how early we see the draft budget. But it is the intention to try and do some overall budget scrutiny at some point. We might try and do something a little bit different to what we have done in the previous 2 years, but it is the intention to try and do something a bit later in the year. And then the other topic that has come forward for ONS board is to do with residents parking. in terms of this committee, the items that we are going to be considering are adding maternity services as a bit of reactive scrutiny, because it's had a CQC inspection, which I think we probably need to have a bit of a look at. So we'll try and find a spot for that at some point, so that we can have a look and see where we need to go with that. Also, be looking, as we have done previously, at the adult social care budget, and trying to find an opportunity, perhaps in September, to be able to look at that in some depth, which we've been fortunate enough to do previously. And then the other item, which has been suggested by Betty, is that we should take an opportunity at some point to look at the shared lives and supported living services. And we're probably going to try and do that in one of the upcoming Fulfilled Lives programme updates. So that's where we are in terms of the issues. So on the work plan, you'll see the timetable that has been set out to try and cover all of those. So I need to get you to agree that draft refreshed work programme priorities, but also you will see on the work plan there is a long list, that's to say a list of issues where we haven't actually allocated a particular date to them. And I just need to give you the opportunity, if you wish, to pick out any of those to that you might want to wish to prioritise. Also, one of the other things I'd like to do is to ask you how you would like to receive information-only items. So we've done this in a couple of different ways previously. We've had briefing meetings which haven't been particularly well attended, but we've also had briefings prior to this meeting, just on particular items. So be pleased to hear how you would like to take those issues forward in the future. And then just I guess to remind the committee that what we did agree quite a while ago now is that we had a kind of particular focus to all of our work, which is that our lens is on equality of access to person-centred integrated care. So that's the way in which we hopefully will look at all of the work that comes to this committee. Lindsay, what have I missed? Please.
Done a brilliant job. You've done a brilliant job, Chair, and you've covered it all. The only thing I would add is just to say to the committee that this is your refreshed work plan for the remainder of the council term, as the Chair has said. So it's good practice to set that out as far as possible for the year. But of course, you keep it under review at each meeting, so you may want to tweak it as it goes along. But this is sort of finalises that work plan activity that we've been doing with you. So it's really to say, shout now, please, committee members, if there are any topics on that long list that you wanted to swap into the work plan with the topics that have been plotted in for you.
Thank you, Lindsay. Yes, so if there is anything that you see on there that you would like us to prioritise, then please say so. But also, I guess just to add that, please don't think this is your last opportunity, but we would like to know quite soon in order that we can kind of work out the work programme going forward. Is there any questions, any particular comments anybody wants to make on any of those issues in relation to the work plan? No? Okay. So I'm going to take it then that the committee will accept the work plan as set out, and that you you don't immediately have any particular issues that you want to prioritise from the long list. And I'm hoping that you will reconfirm the lens that I've described. So that's what I'm going to ask you to do in a minute. But also in terms of the information only items, what I'm going to try and do with your agreement is just to see what the appetite is for the particular issue that we might want to have a look at in terms of the briefings, and just, I guess, check with the committee as we take those items whether you would prefer to have a separate briefing meeting a briefing meeting immediately before this one, or even stick it on the agenda for the meeting itself. Does all of that sound acceptable? Everybody happy with that? Okay, thank you very much for your help with all of that. Do we need to do anything else, Louisa?
No.
Okay, thank you very much for your cooperation. Right, so we are going to move on to item 11 then, which is the BCP Suicide Prevention Action Plan. I'm going to invite Tracy Hill, who is the Head of Programmes, Public Health and Communities, to present this item. I hope that title's right, by the way.
Thank you very much, Chair. So I'm here to present the Suicide Action Plan for BCP. So suicide rates in BCP remain consistently higher than the England average. Sadly, around 40 to 50 lives are lost each year across BCP, many of whom are not known to mental health services. Every death by suicide represents a profound and potentially preventable loss of life, with far-reaching consequences for families, communities and services. This paper presents an updated suicide prevention action plan for BCP, building on the previous plan and also reflecting current national priorities. The National Suicide Prevention Strategy for England identifies 8 evidence-based priority areas. Using these as a foundation, we have developed a local suicide prevention framework that is fully aligned with the national approach. The framework has been shaped through consultation with teams across the council and also wider system partners. This evidence-led process has enabled us to begin to identify 8 clear priorities which recognise that suicide prevention is everyone's responsibility. It also emphasises the need for coordinated action across prevention, early help, support and recovery to reduce risk and improve outcomes for individuals and communities. The intention is for this framework to be adopted by key partner organisations and to inform the development of individual organisational action plans. The paper being presented today focuses on the BCP Suicide Prevention Action Plan, which is provided in Appendix 1. As I mentioned, the action plan builds on existing work and directly reflects the framework's priorities. A stocktake of progress against the previous plan has been undertaken through consultation with council teams. The updated plan sets out a clear programme of work, including actions for BCP council teams and those to be delivered in partnership. While the action plan primarily focuses on council-led activity, many actions align with wider system priorities. This includes collaborative work on training and awareness, as well as improving access to more timely surveillance data. Suicide prevention activity is already underway across the wider system, involving partners such as NHS Dorset, Dorset Healthcare, University Hospitals Dorset, local colleges and universities, and also the voluntary and community sector. A coordinated approach will help align our efforts, avoid duplication, and also maximise collective impact. To support delivery, it's proposed that a BCP suicide prevention delivery group will be established to oversee the implementation of the plan. This group will be chaired by Public Health and will include representatives from teams that have been involved in developing the plan. It's further proposed that the delivery group will be accountable to the Health and Wellbeing Board, providing regular updates on progress, risks and outcomes to ensure that suicide prevention remains a priority within the wider health and wellbeing agenda. Thank you. We welcome any comments or feedback. Thank you.
Thank you, thank you very much. Did you want to add anything, Rob, or shall we just take some questions?
Apologies. So yes, we're bringing this paper today to the committee at the request of the chair and the vice chair, who asked us to refresh the action plan. I'm keen to get feedback, scrutiny and insights from committee members ahead of the suicide prevention plan then going to the Health and Wellbeing Board in June. Thank you.
Thank you, Rob. Are there any questions? Councillor Matthews.
Yeah, thank you. Thank you, Chair. I just wanted to clarify the point that you mentioned that 40 people take their own lives across BCP and they're not kind of known to the mental health services. Is it the case that people are kind of awaiting assessment and they've not been processed? Or is there any statistics on people who just have no no, it just kind of happens. We know there's been sort of famous cases. I think of Gary Speed as an example a few years ago, and I just wondered if there was any data on that, because I think that could be potentially quite useful. So that was the first question I was going to ask. The second point is, I absolutely endorse this in the sense that it is everybody's responsibility. I think we all, take safeguarding and all those sorts of things seriously. So in terms of the strategy and getting other organisations involved, raising awareness on suicide. So for example, the job that my day job, part of the training that I'm a lecturer, but we're always on the lookout if students are mentioning any sort of thought, because it sets off alarm bells. And that's been tremendously, helpful. And I've always been very vigilant with that. I know my colleagues are. But in terms of how it affects all organisations, because actually people in any workplace potentially could be suicidal or at risk of suicide. So it's how we go about kind of spreading the word and raising that awareness right across the spectrum, just like we did with other things. But certainly, suicide it's horrible. I think the other awful case, famous case, for those of you who are sporting fans, Graham Thorpe took his own life a couple of years ago. So it's really, and I know that the ECB, for example, have been doing lots of work in that, in raising awareness, particularly for people who retire from sport, because there's a correlation with suicide in that. So yeah, those are the kind of thing. But I think it's a really important thing. But it's kind of how we do it effectively, I suppose, is my question.
So just to take the first point on the data, so we've got some awareness in terms of the information that I've presented today, but we're well aware that we need to know more about the kind of the data in terms of the suicide. So one of the kind of key actions is to try and link up our information system, so we've got a better picture of who it is that potentially is at risk within society, so we can do some more targeted work. We do have a suicide dashboard, and we've been working with the police over the years to try and make sure that the data that's feeding into that dashboard is as up to date as it possibly can be. But we've got more work to do in that space, but it's a key priority, I would say, for us as a team to get that kind of nearer to real-time surveillance data accessible, so we can almost start profiling across BCP area, so who would be most at risk.
Betty, did you want to add to that?
Yeah, thank you. I can. So just on that point, are they known as well? And just to elaborate just a little bit on what you've said, I think some people are and some people aren't. And it's not necessarily people waiting for assessment. In that circumstance, it could be people that have just come in to adult social care. And I just wanted to maybe just give members a little bit more overview of where things will be picked up and where they are currently being picked up and looked at. So the Safeguarding Adults Board have a key role in making sure that there are SARS, which are reviews of any serious incidences, and sadly often some of them can result in a death of an individual. And looking at that, getting a complete review of all of that and what happened and what led to that, who was involved, who wasn't, what were the opportunities that maybe were missed, and how we factored that in. So that the Adult Safeguarding Board, which you know is chaired by Shan, who comes here and delivers her annual report. So that is a real strong mechanism for tracking anything, a sudden death or an unexpected death, or an increase in the number of people that die through taking their, ending their own lives. So that's really, really important, and that's a partner organisation, and that board holds partners to account, and having those serious incident reviews is really, really important. And then you feed into that nationally and look to see what, is one area more greater than another area, what are the circumstances, and then just some of those areas that tend to fall in, they can really range from people that are struggling and have safeguarding needs, whatever those needs might have been, through addictions, drug and alcohol, and within within the areas that's just been alluded to that will form part of this delivery group looking at the prevention, the suicide prevention strategy. There are already areas that, for instance, in children's and in adults, where we have infrastructures in place, like our serious incident reviews and reporting forums, to really do case reviews as well. And then not to forget the coroner. So the coroner will also cite, because if there's an unexplained or an unexpected death, then it is very likely that that case or that set of circumstances will be reviewed by the coroner, and the coroner will ask all of those interested parties that were involved to produce chronologies and various other things as well. So there's lots of areas of mechanisms where you can draw on all of this information. And this is a really, really important strategy that is key, because reducing the number of people that die through taking their own, that are ending their own lives, is really, really important. And linking in with organisations that really support that work as well, like the Samaritans and others. There's lots more, but wanting to really do that collectively as a group of partners as well. Thank you.
Thank you very much indeed. Are there any other questions? Councillor Armstrong.
Thank you, Chair. I've recently been contacted by a resident who wants to do some fundraising, and she's like acknowledging someone in her family who took their own life a number of years ago, but she's still very much affected and their family's still very much affected. So I'm just curious to know, with regards to priority 6 of the strategy, about providing better information and support to those that are bereaved and affected. I just wondered if you could expand a bit more on that. I'd just like to know how that, so thinking about the resident that I'm working with, how would she or they access that support? What does it look like in the community for the sort of everyday person? Thanks.
Tracy, can you help us with that?
Thank you for your question. Yeah, the support for bereaved is a key priority. That's why we've kind of drawn it out as a separate priority, because we're aware that those people that have been bereaved by suicide are then at a greater risk themselves of also feeling suicidal. So some of the work that we've kind of tried to outline there is, we're aware, as Betty just mentioned, there's a whole host of information and support services already out there. So one of our first tasks is around kind of mapping that to make sure that what is available we can share with people, and then that will also help us identify if there's any gaps in provision that we can then work with our partners to fill. We're also trying to really build in the lived experience within this work as well. So the individual that you mentioned there would be great to speak to make sure whatever support packages that we promote are the support packages that people want. So I hope that answers your question. Thank you. Thank you.
Any other questions? Sorry, Councillor Northover.
Thanks for bringing the review. I'm really pleased to see it, and I just have maybe 3 questions. The first is about, it says about inclusion of the voluntary sector and other organisations. I just wondered if you could expand on who they are, and also I think there may be, I've been contacted by a business that was a sort of community business that delivers training around this sort of thing, and I think they would like to be involved, but I don't know how that might happen. So that was my first question, just to understand how that involvement of others will be done going forward. I was also interested in knowing about, I think around probably just before COVID, we had quite a lot of work in BCP, and that was probably when the last strategy was done, actually. And I wondered what did we sort of not actually manage to get on top of through that time that now we've got this strategy, but I just wonder what we learnt from what we did before, because a few of the things I can see in there about the changes to, say, bridges and things like that. We have actually done loads across BCP on that, and the rail network have put in loads of changes. So I just wondered, is there still people that, you know, is everybody helping with this? Is everybody on board? And then just the other thing is, I used to be on the fire authority, and they had started to be called out as sort of first response, because the police used to get called out when the ambulance didn't come, and now the police are too busy. So it's sort of, it's like a domino effect. But these other organisations are not the right people to be helping people in this sort of crisis. So I wondered, are we addressing that, and are we getting somewhere with getting actually the correct person to be or the correct organisation to come out and deal with things when they're actually at that crisis situation? Thank you.
Thank you for your questions. In terms of the voluntary and community sector, we've got quite a good kind of system network happening. So we're working with quite a few organisations, but if there are any others, then we would very much welcome being put in contact with those. We've done quite a lot of work with the Samaritans recently, but it would be really helpful to have any other names or organisations identified. That would be fantastic. Thank you. In terms of what we've learned from the previous work, one of the key pieces of work that we did to develop this action plan was to do a stock take against the initial original action plan that was in place. And we did that with all partners that have fed into that. So what I think we kind of need to do, reflecting on your really helpful comment, is maybe just to formalise some of the lessons that we've learned through that work that's happened. So we can almost kind of see the progress from that original action plan through to this new action plan, so we can just keep learning from it. So I think I'll take away an action to maybe publicise some of the learning that has come out of that work, appreciating some of the work you've talked about around the bridges and the highways work, which has helped feed into the new action plan. In terms of the fire responding to the first point of call, I'll need to take that away to see, is crisis, at the point of crisis, we've pulled out as one of the key priorities in our frameworks, one of the 8 priority areas. We're well aware that's an area that needs to be looked at. But if it's okay, I'll take that away to see what progress we've made since that was first identified on the action plan, and then I can come back if that's okay.
I just had another question. But thinking back to that, maybe 2018, that's right. We actually also had all the councillors had a like a sort of training, I suppose, on, and it was about how we respond, because at the time there had been several suicides at one of the train stations, and there was a concern that the way it was talked about, and people were doing things like putting posters up, and that this was actually contributing. And so we had a sort of big learning session to try and help everyone to understand what is actually, some things aren't helpful to do, and just looking at the what's written there about spreading information. I just wanted to understand, is that sort of internally spreading using comms, internal comms, rather than public information that could have that unintended result? Is that what you mean there?
Yeah, and I can reassure you that we've that notion that you've just mentioned about publicising it is still very much part of this action plan, and well aware of that. So we will be doing kind of blanket campaigns, but working with the comms team, who are the experts around this. Also, we've done quite a lot to look at what's worked well in other areas. Some other areas have done some really great work around raising the profile of suicide prevention, but in a really targeted way. They've brought in lived experience to make sure that the messages being presented are appropriate messages. So I think we've also got work around utilising the refined data when we get it, that we can do some more targeted communication as well. But yeah, we'll be using kind of evidence-based practice around the comms and engagement work, I would say. Thank you.
I think Councillor Richardson.
Yes, I wanted to clarify the figures. It's higher in Bournemouth than the England average. Are these all people in the BCP area, or do people come here to? So what's the basis of the statistic?
Yeah, it's BCP residents, councillor, so it's not people that have died in BCP area. It is residents of BCP area who may have died locally or further afield. And we're higher than the national average. BCP is an area, not just Bournemouth, and also higher than the regional average too. And I think we're second only to Brighton and Hove in terms of our statistical neighbours. So a real priority for us locally. And as Councillor Northover alluded to earlier, we haven't made the progress that we hoped to have made, I think, with the previous strategy. So really important to think about what did we not do previously, what hasn't really worked. Obviously, sometimes the profile of suicide changes over time, and we receive reports on all suspected suicides, and we try to look at what the common risk factors are in terms of age, gender, ethnicity, any risk factors. We often see suicide linked to, unfortunately, to domestic abuse, both as a victim and also sometimes as a perpetrator as well, and the links with people with drug and alcohol addiction and people with debt and financial problems as well. So it is something that we monitor closely. We monitor the figures monthly in terms of suspected suicides that are reported through to us from the police. And we're very alert to any potential hotspots as well within the BCP area. But the majority of the suicides in the BCP area do take place in people's own homes as opposed to public places.
Thanks, Rob. So that's reassuring, actually, that you're also looking at attempts for suicide rather than just the fatal incidents. That's really reassuring that we're looking at that. But I wanted to come back, if I may, just to the point that Councillor Matthews made before about how we can give this extra publicity. This document, it isn't due to go to Cabinet, as I understand it. It is going to go to the Health and Wellbeing Board on the 29th of June. But I'm just wondering, and I welcome Councillor Brown's views, whether there's any value in adding additional recommendation to this for this paper and the action plan to go to Cabinet, in order that we can then get some further push, if you like, in terms of our own internal communications, social media, press stuff, just to give it that extra wider publicity. So I would welcome observations about whether that would be helpful, and if it's something that could be incorporated into these recommendations. Thank you.
Yeah, thank you, Councillor. I think that would be really helpful. I think the more we can do to promote the action plan, the better. So the recommendation for that to go to Cabinet, we would welcome. Thank you.
Councillor, are you okay with that? Do you want to come sit on the table?
Yeah, thanks for that. Yeah, just thinking about it, I guess it's just around scheduling, because it's due to be coming before the Health and Wellbeing Board on the Monday the 29th of June, isn't it? I think there would be some value actually in it going to Cabinet. I mean, I guess there's not a particular Cabinet decision in terms of allocating budget, or actually sort of Cabinet having to approve the plan before it can go forward. That's but I think almost, I guess, for a sort of information and comment sort of point, and actually, we know the press attend and report on sort of cabinet papers, so I think there may be some benefit in terms of that sort of enhancing the sort of publicity and communication around it, and actually, wider awareness of cabinet and councillors more broadly. So I guess it's just, yeah, looking at the scheduling of cabinet meetings around the Health and Wellbeing Board as well. Would you think it's probably too late to get it before for cabinet to comment before it goes to Health and Wellbeing Board? So I guess it would be for Health and Wellbeing Board to discuss it, obviously, with the partners at the Health and Wellbeing Board, and then maybe then report it on to cabinet for subsequent cabinet comment.
I was just wondering whether we could get a recommendation into the next cabinet meeting, which I think is in a couple of weeks' time, isn't it? Is that doable? I mean, I'm not saying, I'm not precious on doing it on that date, but we could do it on another date. But is it a date that we could make a recommendation to?
Yeah, not as a substantive item, but
Yeah, as a recommendation from this committee.
to consider the the strategy.
Yeah. So is that, what do you think about that, David?
Yeah, just looking at there's a cabinet meeting next week, but then there is cabinet on Wednesday the 24th of June. So that's just the week before the Health and Wellbeing Board. So as long as it works in terms of cabinet board plan and scheduling what goes into that meeting, then I don't see a big problem with it actually going to that cabinet meeting for comment prior to Health and Wellbeing Board. Yeah.
So thinking about it, 24th of June would probably be a more appropriate date, wouldn't it? Because you've got a couple of days before Health and Wellbeing.
If I may, Chair, I think it would be really helpful for it to go to Health and Wellbeing Board first, because I'm not sure we've shared it with Health and Wellbeing Board members yet. And I'm sure, and that includes people like the fire service and other key partners on that group. It would be great to get some of their feedback before it is finalised and potentially taken to Cabinet.
Okay, thank you for that. Is that everybody content with that? That we'll find a form of words which effectively is a recommendation from the committee which asks, Cabinet to support the action plan and to use, internal BCP resources to give it, additional publicity, some words to that effect. But we'll take that, we'll take that recommendation to Cabinet, but after it's been to the Health and Wellbeing Board, yeah? Okay, thank you. Anything else on that? David, stay where you are, you don't have to move. Everybody okay with that? In which case, Tracy, Rob, thank you very much for that. Very helpful, really great to see that action plan. So thank you very much for your time with that. Okay, got to move on to item 12, which is the draft health and wellbeing strategy. So again, this is something which is due to go to the Health and Wellbeing Board on the 29th of June. I think this one is going to go to Cabinet at some stage, isn't it, Rob? I don't know when, but
can do.
Says he, hopefully. Okay. So Rob, over to you, I think, please.
Thank you, Chair. So agenda item 12 presents the draft health and wellbeing strategy for the committee's consideration, scrutiny and feedback. The committee will be aware that it's a statutory requirement in England under the Health and Social Care Act for health and wellbeing boards to produce a local joint health and wellbeing strategy. The previous health and wellbeing strategy for Bournemouth, Christchurch and Poole was published in September 2020 and covered the period from 2020 to 2023. This new draft health and wellbeing strategy has been in development since December 2024, and public consultation on the draft strategy was completed at the end of March 2026. And the analysis of feedback from the public consultation is included at Appendix 2 to this report. The draft strategy sets out our long-term ambitions to improve health and wellbeing outcomes and to reduce inequalities in health in the BCP area over the next 5 years. It has been developed jointly with partners in response to our latest joint strategic needs assessment and is grounded in the evidence of what makes the biggest difference to people's health, centred on prevention, early intervention, and creating the conditions for people to live healthier lives with a clear focus on reducing health inequalities. The draft strategy focuses on a small number of strategic priorities that have been developed by the Health and Wellbeing Board. These are starting well, ensuring that children and young people have the best start in life; mental well-being, helping people to stay mentally well, improving access to services and reducing rates of suicide and self-harm; living and aging well, supporting adults and older people to live and age well and to stay connected and independent for as long as possible; and healthy neighbourhoods and communities, creating healthy neighbourhoods and communities that make it easier for everyone to live well, with shared opportunities for health across our communities. The strategy is not intended to be a detailed delivery plan. Instead, the strategy should be seen as a strategic framework that sets direction, aligns key partners, and provides a shared basis for prioritisation, decision-making, investment, and accountability across the BCP system. The strategy sits alongside a number of other strategies and plans that are already being delivered across the BCP area to improve health and well-being and to reduce inequalities in health, including the Council's corporate strategy, the Children and Young People's Partnership Plan, the Adult Social Care Prevention Strategy, and the National 10-Year Health Plan. The Health and Wellbeing Strategy takes a life course and a targeted approach, recognising that the actions we take must be implemented proportionately to the needs of different neighbourhoods and communities, with those in most need receiving the greatest support. And this is essential if we are to reduce health inequalities. A public consultation on the draft strategy took place between the 17th of February to the 29th of March this year and generated approximately 120 local responses. These responses are currently being analysed and will be used with the feedback from this committee to inform a final draft strategy which will be presented to the Health and Wellbeing Board on the 29th of June. And so the committee is asked to note the progress that has been made to date with the development of the new Health and Wellbeing Strategy. Note that public consultation has now been completed and that feedback from the public consultation and from this committee will be used to inform the final draft strategy. And the committee is asked to provide scrutiny and feedback on the draft strategy to inform policy and strategy development before the final draft is presented to the Health and Wellbeing Board on the 29th of June. Once approved, the strategy will be published on the Council's website and will be used to inform the development of a BCP neighbourhood health plan for implementation from 2027-28. The strategy will be reviewed by the Health and Wellbeing Board on a regular basis to take account of any significant changes in national health policy and in response to any significant changes in need arising from the annual joint strategic needs assessment. So I'll pause there, Chair, and welcome members' questions, feedback and reflections on the draft strategy. Thank you.
Any questions before I pile in and give Rob a load of questions? So I was reading through the consultation report and the responses to the document, and there was a bit of a thread. I think that's fair to say that there was a point of view that this was too strategic in the sense that they didn't have any detail behind it. Nothing wrong with it being strategic, but it didn't have any kind of actions behind it. So I noticed you said that it wasn't intended to be a delivery plan, but I'm wondering if some kind of action plan, delivery plan, would give this some legs, because at the moment I'm not sure where it's going to go. other than it, you know, guiding our work. What I can't see is where the outcomes are, because I don't know what it is we're trying to achieve, if that makes any sense. I'm not saying it's not, you know, it's not worthwhile. It is, because it's important, but in terms of ensuring that we get the most out of this, I am just thinking about whether it would add weight to it to have some kind of delivery plan, action plan, however you want to describe it. Thanks.
Yeah, thank you, Chair. I appreciate the feedback, and I think it, you know, that came across quite strongly in the public consultation, that it was very strong on ambition and priorities, and generally respondents agreed with the strategy and those priorities. But what the document wasn't clear on was how it was going to be delivered. So that's certainly something we will look to include in the final version. We've had some initial discussion around theming our health and wellbeing board meetings going forward to have a specific focus on each strategic priority. Probably need to do a bit more thinking about whether we'll have a separate delivery plan for each priority, recognising that we have a number of plans already in place, suicide prevention action plan being an example of a more detailed delivery plan, and the adult social care prevention strategy also being an example of a more detailed delivery plan too. So what I'd like to do is take that away, do a bit more consultation with the Health and Wellbeing Board about that, and also with my team about how we can look to drive this forward. I'm also looking at identifying a lead within public health for each of those strategic priorities as well, who will take the responsibility for driving forward action in relation to those priorities, and also reporting progress back to the Health and Wellbeing Board as well.
Thank you, Chair. Yeah, no, I've just been looking at some of the details in this. So can I just clarify that one of the objectives of this is to alleviate inequality? That's a key driver, isn't it? Okay, so I'll give you an example here. Reduce homelessness and increase the availability of good quality homes and environments that promote health and well-being. I'm not being cynical here at all, but you can have lots and lots of good quality homes, but that's not the inequality. The inequality is people can't afford them. So this is something I really feel that we need to kind of get across, because homelessness, good quality homes, yeah, there is a correlation, but actually there's a causation by not having secure quality homes that people can afford and homelessness. So I think maybe we need to be a bit more ambitious with that. Just a thought. Thank you.
Thank you very much. Any other thoughts, comments? Councillor Northwood.
I'm interested in it being very strategic, and I wonder if an approach to delivering some of these things is that the public health officers actually come and just intervene in some of our discussions. For instance, when we're having arguments about whether or not to have another cycle lane, I think that public health voice is something that we don't always hear, or you know, in these sorts of environments. And I was just looking through, say, you know, there's the risk caused by tobacco, drugs, alcohol, gambling. Is there a role for public health to intervene in those licensing deliberations, or even put in objections with some of these things? So I wonder if that's maybe more the sort of ways that maybe this is what you're thinking anyway, achieve these, rather than telling other people to, rather than having that sort of delivery framework. Maybe it's to empower you to come in and say, no, we need to do things differently. Thank you.
Yeah, thank you for the question. It's a really important one. And we are doing some work on those things, and it's really important that health is considered in decision making across the whole council. So me and my team are working hard to influence decision making across the council, including, for example, we've provided feedback and commentary in relation to the local transport plan. We've recently commented on the rough sleeping and homelessness prevention strategy, the supported housing strategy. We provided detailed feedback into the local plan as well, and we'll continue to do that as that plan is developed. We're also working really closely, and Tracy supports a lot of this work, with planning in relation to significant planning applications that have the potential to impact on people's health and well-being. So we will look at those and provide public health advice in relation to those applications. Licensing, we've also done some work in that space where we've been made aware, for example, that a license has been applied for potentially for something that could harm people's health, and we have provided data and evidence to support decisions as to whether that license should be granted or not. So we do actually see that as being a key role of public health. And I think one of the benefits of the disaggregation of public health with Dorset Council and now having an in-house public health team is that we can influence those policies and those decisions and those strategies that are being delivered across the council. And we've identified my leadership team as a public health partner to different directorates within the council, so that they know that they've got somebody that they can go to if they need public health advice and input on a significant strategy, policy or decision.
I suppose I would just hope that rather than them coming to you, that you kind of jump in and say, hang on, this is a public health thing, because I think people don't realise necessarily that they're making a decision that could affect public health. So I would say I would hope you'd be more bold, maybe, or yeah, feel that you've got the support to be more bold. Yeah, thank you.
No, thank you for that. I'm really keen to be bold, and sometimes we don't always find out about things, so that's why it's important that we're really proactive in this space. It's also really important why we regularly brief elected members on significant public health issues, that we really help members to understand their role in health and well-being and the decisions that come across to be made as well. Really pleased that when we have papers like these being considered today, we have public health implications as a key consideration in every paper, which is not standard in other councils. So really great that this council is already thinking about the impact of public health of all the decisions that it's making. But a lot more work that we want to do in that area as a public health team within BCP Council. So take the challenge on board.
Councillor Armstrong.
Thank you, Chair. I wanted to ask about the measuring impact section of the report that's on page 129, as I recognise a lot of these performance indicators from when I worked back in the day on the sustainable community strategy that was, I know Councillor Northover will remember, that was actually meant to come into fruition this year in 2026. I wonder, is there somewhere where there is like a baseline? You know, where's the starting point on these indicators? I'd also like to know a bit more about why these particular indicators were chosen, because they seem to be like indicators that have been around for quite some time. And I'm also keen to understand and see how public health is being integrated across the board, because it really feels, and this is my first meeting, so please pardon my ignorance, but just really wanting that assurance that it is being integrated, and what does that look like? Thank you.
Thank you, Councillor Armstrong. So the indicators have been identified through the Health and Wellbeing Board, who wanted to focus on a small number of indicators, because we do have a whole range of public health outcome indicators that we monitor on a regular basis. So all of these indicators are the key ones for monitoring health and well-being within our population. They're also some of the ones that need the most work. So there are baselines, and we've also got trends. So we know against all of these, we know how we compare to national averages, regional averages, our statistical neighbours, and what the trend is, whether it's something that's been improving or reducing over time. And some of the specific ones that we've got in there, such as the suicide rate and the self-harm data, are areas where we know that we are currently, our position is worse than the national average, or it's worse than the regional average as well. So that's how they've been chosen. It doesn't mean that these are the only measures that we have, but they are measures that we can use to measure progress against each of those strategic priorities. And we are able to provide the baseline and the direction of travel in relation to those. They're also the most robust because of the ones that are nationally published, and that are validated as well. So they are typically indicators that we will see in the public health outcomes framework, but also in the new set of local government outcome indicators as well. And that's important because it enables us to benchmark ourselves against other local authorities and to see whether we're making enough progress or not.
Can I? Thank you for that. I mean, looking at some of these indicators, I mean, I recall like back in 2011, 2012, 2013, these were still considered to be priority indicators at that time, when now in 2026. So my question is, what is the reason for that? Particularly, I'm looking at things like hospital admissions, that are for people aged over 65 and over, alcohol-related hospital admissions. I remember that being an issue. Again, under 18 conception rates, obesity. They're very, yeah, it all feels like very similar to like over a decade ago. So I'm just wondering if you could say a bit more about why that's the case. Thank you.
Sure, yeah. So these are long-standing public health challenges. Such as obesity and under 18 conceptions, although we have made significant progress on those. So these are the key drivers of poor health within our population. And they are indicators that are going to take a long time to be able to turn around. So they are the most important drivers of ill health in our communities, and the ones that require the most partnership action to turn them around as too, because the reality is it isn't just my team that can influence these indicators and turn these around. These are endemic public health problems that require coordinated and sustained action across a number of key partners, including the council, but also the NHS, the voluntary and community sector as well, and residents themselves.
Any other questions? Just coming back to this point about the section of the paper that talks about making it happen, you know, which is about actions. I guess I'm thinking about how are we going to measure any outcomes from this. I kind of get that the Health and Wellbeing Board will be looking at the kind of direction, but where is the analysis of, are we making a difference? Are we shifting behaviour? And how do we kind of do that, really?
Yeah, so some of that, Chair, will come through the measures that are listed in the section above that. So often that data is published annually. So we will be able to track progress against those measures over time. In terms of the delivery of the plan itself, we will look to provide a report against progress against each of those priorities on a regular basis to the Health and Wellbeing Board. And we can also look at how we produce some information that we can put into the public domain as well in terms of the progress and that we've been making against the strategic priorities, and whether any of those indicators change. Need to recognise there's often quite a lag on when the data is published from when the kind of activity has taken place. So quite important that we have the clear outcome measures, but also that we look at what proxy measures we can also gather at the same time to give us an indicator as to whether things are on the right course or not.
Councillor Brown.
Yeah, thank you, Chair. I just wanted to come back and just in response to Councillor Armstrong's point actually about the impact measures and the same sort of things that we've been looking at for 5, 10, 15, 20 years. I do remember a conversation probably a year or so ago, I think it was with our previous Director of Public Health for Dorset, and he said in some ways actually there's nothing new in actually human health and ill health. We know what sort of helps human health in terms of physical activity, reducing obesity, smoking cessation, managing drug and alcohol addiction, those sorts of things. In some ways, it's what we've always known is what we still know. It's a case of there's different approaches. There's more data and more research into how we can actually address those issues, and there's new plans about how to reduce inequalities and actually get to the people that really need to sort of work with. But I think that's why some of the measures are the sorts of measures that we've been looking at for years, because actually in some ways there's nothing particularly new in what it takes to actually be a healthy human, have a healthy body, healthy sort of mental health, those sorts of things. So I think those measures were as valid 10, 20 years ago as they still are now. It's just new research that goes into those and new ways of approaching them and finding the people that we need to sort of really work with to sort of manage inequalities in those sort of health outcomes. So.
Thank you. Any more questions of Councillor Dedman? Councillor Dedman and then Councillor.
Sorry, you were first.
Sorry, I didn't see you, Councillor. Please.
Is that me? Yeah. Yes, I'm looking at the falls and the 65 plus age group, which brings us back to one of my old questions, really. Any plans for suitable housing developments for older people? Because many of them are living in family homes on their own, falling downstairs, blocking housing anyway. So.
Would you like to take that question, Zena?
Yeah, so, sorry, could you just repeat it? About old people's housing.
Just the elderly population, many of whom are living on their own in large or not so large family homes, but at risk in their own homes. Are there any plans for access to suitable housing developments for, the older population who don't want to live in a great big mansion?
Yeah, I mean, obviously we're working with housing colleagues on alternatives of all accommodation for residents of BCP. Obviously, the most notable one is the Oakdale site that's still in progression, and the plans are being reviewed, and that will be obviously look for different client groups, older people, different learning disabilities, and there's the Hillbourne site as well that's ongoing as well. But I would need to go back to housing colleagues to get a fully update, progress report on that. But yeah, there definitely are options, and there's also a strategy, a specialist housing strategy that has just gone out. I think it went to cabinet actually.
But presumably money would be a consideration with that sort of plan, yeah.
I think the sites that are being developed. So I probably would need to go back to. Don't want to give incorrect information. I probably need to go back to housing colleagues to get full. But they are the Hillbourne one is being developed. The Oakdale site is in planning.
Are they for very vulnerable people or just elderly people who want to live in something easier?
We'd always try to support people in their own homes. So if they want to downsize, obviously that's housing would support them through the home choice lettings process. I'd need, again, housing colleagues would need to provide more information on that. But we'd always try to provide
people to stay in their own homes. If they need care and support, that's where the extra facilities like the extra care housing, supported living would come into more of appropriate accommodation.
But then they are blocking family homes, aren't they?
I think housing colleagues tried to support people to move. I tried to answer something that I'm not. Our housing colleagues would support people to move out of big family homes if they want to, and obviously for adult social care we would provide that support if necessary if their assessors needing support. But again, the prevention strategy is all about supporting people that are lone, that potentially are at risk of being lonely or not linked into their community. So that's the work that we're doing in adult social care, linking with public health as well.
So, did you want to add something on that point?
Yeah, I think your point's a really good point, and I think the people that own their own properties and people that live in social housing that is being provided through the council or another provider, I think the circumstances of those individuals wanting to downsize or needing to downsize are the same, irrespective of whether they own or they're supported to live somewhere. And I think Justina's point around extra care housing is really important. And we have lots of environments within the BCP geographical area for particularly people that are of a certain age and where they may wish to downsize, people that either 60 plus or 65 plus, or people that have disabilities become more, their function has become more hindered, so therefore they can't stay in the house or the environment that they were in. So for that, that would be part of looking at their overall assessed needs and working with them and their families. And there are options, for both those kind of categories. And for me, it's really important when people own their own properties that they get the right support to be able to do that as well. And that support looks at the longevity of whatever environment they might be going into. And you're aware, Councillor, that the extra care housing facilities, either the private elements of them or the non-private element of them, have wraparound 24 care provisions as well, so that people go in with the intention that they can stay there. And it is about being able to work with them to help them to plan for that move. And it is done through, jointly with the council, particularly if it's adults, it would be with housing partners, as Sina said. So yeah, and it can take a little bit of time, but it's really important that we get to those people. And as Sina said, the prevention strategy really helps us to be able to do that as well. Thank you.
Thank you. Can I come back to, I think Councillor Dedman wanted to say something.
Yes, I was feeling very glad that I live in a one-bedroom house, so I'm not blocking anybody else. Thank you very much. One-bedroom flat, rather. No, what I wanted to say about this whole report is that I really think it's wonderful. It's very enlightened. It's got wonderful aims, but there was a mention of, I don't know who said it, changing people's behaviour. And in my view, that is a Sisyphean task. You can never do it. People, I mean, I know my behaviour has never changed since I was 20. Yes, it has. I don't smoke anymore. That's the only thing. But all the other terrible things I did, I still do. And I think that bit you need to understand. We need to understand that people have habits. And the other thing is that, and I'm going back now to the 70s, which I can quite easily do, things change with health. And when I was expecting my first child in the 70s, there was a scare about eating potatoes because it was thought, you see, you're looking baffled, aren't you? It was thought that they caused spina bifida in babies. Now, if you look back up, you'll see that. So I spent the whole time not eating potatoes. So everything changes throughout the years. And obviously now we think potatoes are a good thing, I'm imagining. But it's that thing about behaviour. I think it's going to be a great effort to change all that. But really well done. I think it's very enlightened. So thanks a lot.
Thank you, Councillor Dedman. I really appreciate the feedback. Would like members to to take away that what we know about what will have the biggest impact on people's health and well-being is actually addressing the structural and social and economic determinants of health, which we've talked about today, such as housing, the quality of housing that people live in, the built and the natural environment, and the educational attainment of our children, opportunities for good, well-paid employment, lifting people out of poverty. And these are the things that will have the greatest impact on people's health and well-being, and also on reducing inequalities. So the individual behaviour change is important, it's part of the picture, but as you say, it's a Herculean task in some cases to change people's behaviour. And so we mustn't go down that route of thinking that public health or that health and well-being is about getting people to change their behaviour. It's part of it. It's also about changing the circumstances and the conditions in which people live, work and play. And that's really important too. And that's why the strategy has that broader focus about how do we give children the best start in life? Because what happens to children when they're younger influences what happens to them as they age and get older as well. So really important that we get in early and give children the best opportunities that they can have to be healthy, and also then throughout adult life and into older age as well. Really important that we're supporting people to remain healthy, to be physically active, to stay connected with their local communities and with their family and friends as well. So yeah, thank you for the questions and the feedback.
Just come back on that. Totally endorse that about the children. That is where it should start, isn't it? I know it goes on and on, but yeah, absolutely. Yeah.
Okay, thank you, everyone. So, Rob, do you think you've got enough there in terms of feedback? We don't have to do belt and braces or anything. You've got enough there in terms of feeding that back into the system.
Yeah, it's really great and it's really helpful, and I'm pleased that we did the public consultation.
Yeah.
We're not obliged to undertake a public consultation on the health and wellbeing strategy, but it was something that the Health and Wellbeing Board wanted to do, and that I wanted us to do too. And I'm quite pleased actually with the feedback that we've received through that, and it's really helping us to think more critically about the strategy. And also how we probably need to also, the other strong feedback that we received was in relation to the clarity of the strategy and how easy it was for residents to understand as well. So we got some really good constructive feedback into how the strategy can be improved. So thank you to the committee for its feedback so far.
Okay, can I just then ask the committee to formally agree the recommendations that are set out in the paper? Everybody content with that? Okay, thank you very much indeed. Right, so item 13 is the public health disaggregation, which was mentioned in passing. So again, I'm going to hand over to you, I think, Rob, please.
Okay, thank you, Chair. So agenda item 13 is a report on provides an update to members on progress following the disaggregation of Public Health Dorset in April 2025 and the establishment of two separate public health teams within Dorset Council and Bournemouth, Christchurch and Poole Council. It also sets out the proposed future direction for how some public health functions and services will continue to be delivered and commissioned, including where joint working between the two councils should continue. Over the past year, the priority has been to establish the two new public health teams while maintaining stability and continuity of public health services for local residents. During this period, a number of public health programmes and contracts have continued to operate on a joint basis, and the majority of the contracts for public health services are still held by Dorset Council. This approach has ensured services remain effective and responsive, while a longer-term review of commissioning and governance arrangements has been undertaken. Members are asked to consider and agree a set of guiding principles which we have developed to guide our work and that will shape future decisions. These principles emphasise that our work should increasingly move towards a place-based focus, with joint working with Dorset Council only where it makes sense and where there is a clear benefit, such as improved quality, efficiency, or value for money. Where services remain jointly commissioned, appropriate governance and oversight arrangements will ensure transparency, effective performance management, and statutory assurance through the respective directors of public health. An overview is provided at Appendix 1 of our anticipated contract and procurement activity for 26-27 and 27-28, and this includes those services that are expected to remain joint with Dorset Council, those that will transition to a single lead authority over time, and those subject to re-procurement when current contracts expire. All of the proposals have been developed with legal, procurement and finance colleagues and are aligned with existing contractual commitments and the 3-year indicative public health grant settlement from April 2026. The purpose of the paper is to seek the engagement and input of elected members through the Health and Adult Social Care Overview and Scrutiny Committee prior to an update being considered by Cabinet. So the Health and Social Care Overview and Scrutiny Committee is asked to consider the report and make recommendations to Cabinet that endorse the progress made to date, agree the proposed principles in the paper for future joint commissioning where this makes sense, and support the recommended future direction for public health services. And I'll pause there, Chair, and welcome members' questions and feedback.
Thanks, Rob. Could you just help us initially with one thing on Appendix 1, which is some of the proposed lead authorities are still to be confirmed, which is what I assume TBC stands for. I mean, that may be partly to do with the date, but is there any clarity about where those are likely to end up?
Yeah, thank you, Chair. So it's the clarity on, I mean, so in terms of the list, what we've done is obviously looked at those services where the contracts are due to expire first. And we've started to think very critically about, are we planning to commission these services as separate councils going forward, or are there still benefits to commissioning those services jointly in terms of performance, quality and value for money? So that is why some of the smaller contracts, or the ones that are not yet due for renewal, have not been considered yet by both public health teams. So really that's just the explanation. But in terms of the principles, Chair, it would be that we will look to take a place-based approach by default. So the principle is not to continue to commission them jointly just for the sake of commissioning them jointly, but to actually look at whether we are better commissioning these at a place-based level, whether we want the same type of service and the same delivery model going forward, and whether there's any economies of scale in continuing to commission these things jointly or not going forward. So that relates to the principles within the paper, but the default is place-based commissioning approach first, joint commissioning only where it makes sense to continue to commission things jointly. And that's a way of us trying to both manage the volume of contracts that we need to re-procure or novate from Dorset Council to BCP Council, and to kind of stage that over a period of time as well.
Thank you. I think Councillor Allen's online with a question. Hazel, please.
Thank you. Thank you, Chair. I'd just like to ask Rob, I just wondered what you feel, what some of the opportunities might be going forward, because you're talking about place-based commissioning, place-based services, you know, meeting the needs of the demographic and the requirements of our area of BCP, where we're potentially going more local by having our own public health, which is excellent, and I've advocated for that for many years. So I'm really pleased that it's happening. But then you look at the ICB getting bigger and also almost moving away a little bit from locality. And I just wondered where you see the opportunities come around what you can do and what we can do as a council to having our own public health. Thank you.
Okay, thank you, Councillor Allen. So I think there are more opportunities now than previously to take a place-based approach to commissioning. And I think that is true even in the context of where we're seeing the ICB clustering into a much broader geography. And there are certainly some services where it makes sense to commission them at scale and to commission them on a cluster or strategic level. But there's also, it makes sense to commission a lot of services locally, and that's because the needs of our populations are different. So I'm very clear that the needs of the BCP population for some services are going to be very different from the needs of Dorset residents for similar services. For some of the services, there's a national specification, there's a national programme, it needs to be delivered in line with that, and we therefore benefit from some economies of scale in doing that together. But for other services such as drug and alcohol, for example, which is commissioned on a place-based level, it hasn't been part of that Pan-Dorset collaborative arrangement. It makes sense to do that at place because the drug and alcohol needs and the profile of people needing those services within BCP is very different to the demographic profile and the needs of people within Dorset Council as well. So I think the opportunities are substantial in terms of being able to commission more locally and more sensitively to the needs of the local population. In order to reduce inequalities, we maybe won't see that masking of inequalities when you're commissioning sometimes at a much broader level. And I think through things like the development of our place-based partnership, and our arrangements with the NHS, and we've got our place-based director for BCP from the ICB cluster board on the call. We've got real opportunities that many of us are advocating for certain services to be delegated for commissioning at place, and where it makes sense for services to be commissioned at place level. So long answer maybe to a short question. I think it's all to be played for, and I think we're in a good position, I think, with our cluster ICB in terms of they've listened to our views and our needs in relation to the importance of place-based commissioning, engaging with local residents, and they're open to looking at more delegation of NHS commissioning at a place-based level as well, whereas previously it was done at a Pan-Dorset level.
Yes, thank you. And as you know, my my area of interest is particularly around people sadly with addiction issues, but also those that experience homelessness. I obviously have to declare that I work with the health bus, which delivers healthcare to the homeless on the streets. So I am obviously have a vested interest in this, but I do think that those particular needs, I'm not saying they're unique to BCP. I know there are other areas in this country that are having significant issues with homelessness, with drug and alcohol. I'm also the councillor for Bournemouth Central Ward, and it continues to be an ongoing challenge on many levels to try and support people that are struggling with a lot of these challenges. And I'm really pleased to hear that that is the focus and should be the focus, because I just feel that there is so much more that could be done, and particularly around health when it comes to this particular vulnerable group. So thank you, and I just hope that we can continue to push forward and that the public health can be at the forefront of that. Thank you.
Thank you. I can see both Laura and Becky online. I can't see any hands, so just wave at me if you want to say anything. Okay, thank you. Nobody's waving. So I'll carry on. Just want to get clarification in my mind about how this works in practice in terms of the commissioning. So, for example, in my ward in Boscombe, there's a thing called the Sovereign Centre, it's a shopping arcade. And recently, Dorset Healthcare have taken a unit in there and are providing advice, health advice, for anybody that wants to pitch up and go in there. So they're offering blood pressure tests, flu jabs, all of that kind of stuff. On demand, really, just kind of pitch up and go in and ask. And the thing that went through, I mean, I'm pleased that don't get me wrong, but what went through my mind is why they are doing it. Why, get very precious about this stuff. Why are they doing it and why aren't we doing it? So is that anything you can help me with?
Yeah, it's both the answers to the question. Let me answer this a different way. So the shop in the Sovereign Centre is the Live Well shop. So that is a public health team, and that team is employed by Dorset Council. So people, and I saw something recently in the media that talked about it being Dorset Healthcare. It's not, it's actually Public Health are leasing the shop, and it is being staffed by people from Live Well, Dorset, but they are still contractually employed by Dorset Council, because that service was developed by Public Health Dorset as it was then. What we do have is that shop is being used by Dorset healthcare staff too, to deliver some of the things that you've mentioned, such as potentially vaccinations to people that would be eligible for that. So wouldn't want necessarily the committee to think that that is an NHS-led and delivered initiative. It is a public health-led and delivered initiative. But we're opening it up for other partners to be able to deliver their services from that location as well. Does that help?
It does help, but but why Living Well? Why can't we do it?
Because the Live Well Dorset team is part of Dorset Council, so we commission that service. So we use some of our public health grant goes to Dorset Council to provide the Live Well service. And the Live Well service provides Live Well services across the whole of BCP and Dorset Council. And that service is delivering things like NHS health checks, it's delivering some of our stop smoking support, and it's delivering health coaching to BCP residents as well.
Yeah, I'm not trying to be difficult. I'm just trying to understand. For reasons which I won't bore you with, that I was aware that somebody was referred from a GP practice to Living Well to manage potential diabetes. Now, why is a GP practice in Bournemouth using Living Well to do that? Why, I don't understand why that's happening.
I think it will be happening. I'm surprised they're being referred to manage their diabetes, but Live Well is our gateway to, as well as stop smoking support, it's also the gateway to weight management services as well. So referrals are made by GP practices and lots of other NHS providers across the BCP area to Live Well for people who need help around behaviour change. And to lose weight or to be more physically active or to stop smoking. That's part of the services that Live Well provide, and it's services that we as a council commission Live Well to provide.
Okay, I'm not going to press you anymore, But anybody else wants to ask anything on this issue? If not, then thank you very much for the paper. I'm just going to ask the committee if it's content with the recommendations which you described at the outset, and which are in the paper. So is the committee happy with the recommendations, happy to accept the recommendations in the paper? Okay, thank you very much then. Last but by no means least, portfolio holders update, please, Councillor Brown.
Thank you, Chair. Yeah, and actually it's interesting, the point you made on the last conversation about the place in Boscombe, because it sounds to me a bit similar to the Access Wellbeing hubs as well that we've got in Boscombe and Poole and elsewhere, where very much it's like Dorset Healthcare lead, but working with the voluntary sector in those. But I think you go into those hubs, I've been into the one in Poole a couple of times, and you realise about the partnership working, because it's not just the NHS there with the voluntary sector partners, but I bumped into some of our social workers working out of those bases as well, and our housing teams go in there as well, and I think that is probably the way forward, because a lot of the people that are dropping into those actually can benefit from support, whether it be from housing or meeting their social worker there, and at the same time sort of NHS people. So I think those are the sort of things that demonstrates how partnership working is really going to progress, whether that be on the sort of mental health side or physical health. So yeah, I think there's some quite exciting initiatives going on there, and they're really benefiting those people. And actually those sorts of approaches, but having them in the shopping centre, are really important about improving accessibility to healthcare and reducing those health inequalities. I think that's where they really come into their own. So yeah, just a comment on those. Just in terms of my portfolio holder update, there's not as much to update as normal. We had a little thing like election period, unfortunately, got in the way in the last couple of months. But yeah, I think I mentioned last time about the draft health and wellbeing strategy, and that consultation is now completed, and we've had some of the update tonight, which will be coming to the Health and Wellbeing Board. Also mentioned last time about the draft learning disability big plan for 2026 to 2031. That consultation is now completed, and actually there was an update to the Learning Disability Partnership Board that was discussed by that board last week on the 14th of May. And there's some really sort of interesting sort of results from that, and there was a really sort of healthy discussion at the Learning Disability Partnership Board on that. Other than that, there's been a few interesting events. The Dorset and BCP Safeguarding Adults Board had a big development event back in March, and that brought together not just those people on the Safeguarding Adults Board, but there was sort of other people there as well to really sort of work through how that's going to be progressed and improved. So there was also in March the Adult Social Care World Social Work Day, which I popped in, and I think quite a lot of our social workers there. Betty, you're obviously there, and that was quite a well-attended event. But a lot of the last couple of months, I've had a lot of contact with Tricuro. We have our regular sort of Tricuro board meetings that I sit in on, that also Laura and Zena have attended, and we have our Tricuro governance meetings, shareholder governance meetings. They had an open day at Clarkstone Connect. I advise all board members or committee members to keep your eye out for when Tricuro do have open days at any of their places, and to try and drop in and see them and learn a bit about what they're doing at the day centres or their other places. But the Parkstone Connect Open Day was really useful and informative, and again there was lots of sort of voluntary sector groups and carer support groups there as well to meet with people. But myself and Laura actually did a tour round of quite a few of the Tricuro centres. The Boscombe Connect, visited Boscombe Connect, also visited the Wallfield Learning Disability Residential Home, 11 House Mental Health Supported Living Home, and Coastal Lodge Reablement. If any of you aren't familiar with Coastal Lodge Reablement, I'd advise you to sort of look up a bit about it, because it's one of those services that I don't think many people at all realise that the council actually deliver. But it's really, and actually I've had a friend who was in her 90s and had been in hospital and came out of hospital but went to Coastal Lodge for a period to actually help her get her sort of fitness back so that she could move back home. And she's back at home being looked after by her son. But I think it's one of those services that actually really, for a lot of those typically older people within our communities, is really beneficial for them to actually help them maintain their own independent living at home, particularly when they come out of hospital. And it's not just at Coastal Lodge, but the community reablement team that were based there are going out all day, every day, you know, right across our communities, helping people with their own homes to sort of to remain independent. So really, really beneficial services for so many people within our communities, and the number of referrals seems to be going up and up there. So and it's something that I just don't think the public realise that the council are delivering, and it's you know, it's a really impressive afternoon actually touring a lot of those centres, and really eye-opening. So I think there's a lot of opportunities for Tricuro. I think there's, you know, it's been difficult since the separation between Dorset and BCP, and with new people coming in at Tricuro, but certainly I think they're helping us to sort of look at the particular things that Tricuro need from us as the council, particularly around things like building maintenance, to help them deliver effective services. But they're definitely got their eyes on sort of the opportunities they've got to actually improve the services they're delivering for BCP residents, and potentially move into new areas and really progress in the future. So yeah, we've had a lot of really sort of useful and positive meetings with our Tricuro colleagues. And other than that, obviously, sad news of Betty departing, which you've mentioned today, and I think that's going to be a great loss. But I'm glad that we've sort of managed to sort of work with Tim to take on as the interim DAS. And yeah, I think there's a lot of that sort of organisational knowledge that we'll sort of still maintain actually by approaching that way. So yeah, a time for change, but also a lot of optimism about where we're going. So.
Thank you very much. Any questions for the portfolio holder? Councillor Dedman.
No, it's not a question. It's just that I was portfolio holder before David. So I'd like to say Betty was an absolute wonder. She was kind, considerate, helpful. Everything was not too much trouble. Still is the same. So going to miss you.
Anything else? If not, colleagues, thank you very much indeed for your attendance and for your input. And I'm going to close the meeting. So thank you very much.